Sunday coming up to lunchtime at NHS Hack Day in Cardiff. I'm here with James Morgan, who is my co-organiser, Professor of Ophthalmology in Cardiff University, who very kindly have given us this building now for 5 years to do NHS Hack Day. How's it been?
It's been great. It's been our best Hack Day, and we've had more people, I think, than on any other occasion. And the university has been great as well. That they haven't, I guess, given us the building, but the infrastructure and support has been great, and also University IT. We're really grateful that they've supported us.
They were super. We had a great technician yesterday who we got some things adjusted with the Wi-Fi to make it work, and like this is the kind of thing that really makes an event like this work. So it's fantastic.
And the one thing these guys run on is bandwidth and coffee, and we've had plenty of that for the weekend. So it's just so invigorating to see what you can do in the NHS and with the community in the UK, and it's really vibrant, isn't it?
It is.
And what I found it great is just connecting people in the room. Mm-hmm. I know somebody who's done this, and we've met somebody else, and we can pair them up, and so they can do the projects. But the Hack Days are also about networking. About networking.
Networking, absolutely.
And making a material difference, which I think we're seeing. Yeah,
and we got, in a way, this space is kind of quite good because we are kind of all working in the open here.
Yeah.
So people are able to go between projects and take a step outside and have a chat with somebody and then come back.
It's a fantastic space. I don't think it was ever designed with this in mind, but they have built basically an incubator for 6 or 7 companies that we're doing, and I think that's what has helped us make Cardiff a success.
Yes, yeah.
I'm not sure the weather's helped, but maybe it keeps everybody trapped indoors. I don't know. That sort of it feels a bit like Seattle, doesn't it? I guess.
We're never going to get great weather in January, are we?
No, I would say this is the Welsh Summer, so let's open our keyboards and do some coding.
So we were. We've been doing this for a few years. This is our 5th year.
Well, this is year 5, and I think this is a key point when you set something up, because this shows it's sustainable. And I think it's fair to say, in terms of organisation, this has been for us the easiest year to set up because our funders have been great. They've expected the request. The university supports us with the accounts, and everybody expects it to happen. And they pitch it. January is Cardiff, and so the community come. And what I find great is that it's not we've got engagement from the local Welsh group, but huge input from England as well. A lot of people from London. We've got also the international presence this year with two youngsters from the States. We've got somebody from Georgia and from Washington who are visiting UCL and have come down to Cardiff, and they're learning about how the NHS works, and hopefully they'll take those ideas back to
we've got a few people from NHS Digital, NHS England, all kinds of different organisations across, from the health boards, from NHS Wales Informatics Service, and more of a growing presence actually from NHS.
The NWIS involvement this year has, I think, been great because we've had Rob Jones has been down with his team. We've had a team from Bridgend as well who have come, and they can take those ideas and enthusiasm back, because although they organise their own Hack Days, this is one where you get clinical engagement to a greater extent, and you, just by virtue of it being on a weekend, you get the super enthusiastic people who are just there all the time to make it happen. Brilliant. And I think that's what's so encouraging. I don't think it's kind of amazing. It's a weekend and nobody is being paid to do this, and they are giving up their time. If we had to attach a bill to this would be a very expensive event.
It would.
But this is what I think the NHS is all about.
We've got 100 people turn up to work on something
and
for free.
Let's be clear, they pay for their own travel, their own hotel fees. We feed them, we give them bandwidth, and warmth and light, and that's about it. Now, I'm not recommending this as a solution for the NHS. So if Jeremy Hunt is listening in, this is not the way. But this is just feeding off the enthusiasm of the NHS.
It is. So. Well, James, thanks from the first time when I went to you and said we should do this. You've been great to work with on it.
It's been great working with you.
So thank you very much.
Great, thanks.